Today I'm going to be talking about Bordetella pertussis. Bordetella pertussis is a gram-negative rod-shaped bacteria. It's a human pathogen found in the mouth, nose, and throat of infected people. The bacteria attach to cilia in the upper respiratory system. The bacteria then release toxins that damage the cilia. This causes the airway to swell. This is the known causative agent for whooping cough. Bordetella pertussis is primarily transmitted through respiratory droplets, so coughing and sneezing. It's highly contagious. Affected individuals are most contagious during the first few weeks of infection. According to the Children's Hospital of Philadelphia, 8 out of 10 non-immune individuals will be infected when exposed. The most at-risk groups include infants, unvaccinated individuals, and older adults. So the symptoms of Bordetella pertussis can be broken up into 3 stages. Stage 1 lasts about 1 to 2 weeks, and this is when individuals are most contagious. Symptoms include mild fever, occasional cough, runny, stuffy nose, common cold symptoms. And then stage 2 can last about 1 to 10 weeks, and this is when severe dry coughing fits occur, followed by a whooping sound. Stage 3 can last 2 to 3 weeks, but it could also last months. The coughing severity and overall occurrence gradually decreases over that time. Infants that become infected may not cough, but can show signs of apnea, so pauses in their breathing, or cyanosis, which is when they turn blue due to lack of oxygen. More than half of whooping cough cases involving infants less than 1 require hospitalization. This slide shows the road to the modern-day vaccine. So the oldest known epidemic occurred in Paris in 1578. Then fast forward to the 1920s and 1930s, the United States saw over 250,000 cases per year and up to 9,000 deaths. In 1948, diphtheria, tetanus, and whole cell pertussis were combined into a vaccine and licensed. Then, by the 1970s, routine childhood vaccinations led to over a 90% decrease in U.S. cases. In 1997, acellular pertussis replaces whole cell, resulting in the current vaccine that we use today. This change was made because the newer vaccine has less side effects. And then in 2005, the booster was licensed, and this is the booster that's recommended for adolescents and adults. So the current status of Bordetella pertussis cases in the United States, they are currently increasing, and they have been increasing over the past several years. The CDC reported 35,435 cases in 2024. To compare that, there were a total of 7,063 cases in 2023. Several factors can be influencing the number of cases, including the fact that vaccination protection fades over time, hence the need for a booster. Current vaccinations may not be effective for all strains, and transmission still occurs even in vaccinated individuals. The treatment for Bordetella pertussis includes the prescription of antibiotics. In severe cases, hospitalization might be necessary, and then it's also recommended that affected individuals avoid irritants such as dust, smoke, or anything that might affect the respiratory system. The number one way to prevent Bordetella pertussis is going to be through the vaccine. This is a series of shots that's given during infancy and young adolescents for the diphtheria, tetanus, and pertussis. Booster shots are recommended for adolescents, adults, and pregnant women during their 3rd trimester. And then some other ways to just prevent the spread would be through washing hands and covering your cough and sneezes. That's all I have on Bordetella pertussis. I hope you found it helpful, and thanks for listening.